Y'all, the medical system is broken, and I'm a physician, but I'm also a patient. And I want to share my experience with you to help somebody else who might be struggling with the same kinds of things. And I don't know if any of you guys have a lot of sinus infections, but I've literally had sinus infections for the last 26 years over and over and over again. And anytime we're the patient, I think we tend to blame things or explain things on circumstances that make sense to us or that make us feel like we understand why. But literally last week was the first time, last month was the first time I had an inkling that there was a reason why I've had so many problems for all these years. And I finally feel like I'm putting the pieces of the puzzle together, and I want to share that with you because I think it can help somebody else. So I'm going to try to be brief. This is like story time, but it involves sinuses and teeth. And actually I had some tears in the endodontist chair last week because the answer is so simple and I had no idea. So here goes. So I'm a kid of the early 70s. I had lots of fillings when I was a little kid. We didn't used to have fluoride in our water. There's a plug for fluoride in the water. But in the 70s, they used to do fillings and they would drill out a lot of your tooth. And so I had a lot of teeth that were really damaged from all that dental care early in my life. And so I started having to have crowns when I was in my mid-20s because my teeth were kind of wearing out. So I've had lots of dental work. And in the late 90s, when I was a resident, I was a medical resident, and I'd had my son, and I was working 80 to 120 hours a week and under a lot of stress, and I had a crown done. And it was on my upper, actually both of my upper, number 3, and I guess it's number, I don't remember what on that side, but anyway, 2 upper molars, and they had left this one too high. And I was clenching a lot and ended up with pain in the nerve, and they ultimately sent me for a root canal. And I think it was about 1999, and they did this root canal and the pain went away, and I've never had pain in that tooth again, ever. And within 6 months to a year, I started having sinus infections, and I attributed it to being sick from viral infections I was exposed to. And certainly every time I got a virus from a kid, I would get infected. And that first 2 or 3 years I was doing this, it was when I was a resident, I was working all the time and I was taking care of other people. So I would get some antibiotic samples and take them and move on. And so that's what I've always done as far as getting treated and just taking care of everybody else. And so in about 2001, I went into private practice and continued to get sick. And it was mainly this sinus that got infected, the one near this root canal. And I saw one ENT and he told me, I was just having a lot of colds, that I really wasn't having sinus infections, just gaslit me altogether. And, I would tell him I was having fever and blood and pus coming out of my nose, and it's just a cold. And so I quit seeing him. And meanwhile, I'm seeing the dentist every 6 months and having x-rays, and everybody tells me everything's fine. And so 2003 comes around, I'm still getting sick, still on antibiotics all the time. And so I went and saw a different ENT, and he did surgery to open up my sinuses and straighten my deviated septum. I probably did need it. Then I continued to have infections in this sinus. So I had a revision in 2004, and then fast forward for the next 20 years, and I had recurrent infections, diagnosed with allergies, diagnosed with other things, had problems with my weight, and my gut bacteria were all messed up, and my belly hurt a lot, and lots of horrible acid reflux, and I don't know if that's related. But anyway, so lots of problems, and I've addressed all those things. I've always gone to the doctor. I've always gone to the dentist. I've switched dentists a couple of times. No dentist has ever said anything to me about my teeth. And other than just fixing the crowns and an occasional root canal. So I went to an ENT 2 years ago, and I didn't get to see my regular guy. I saw the PA, and she reassured me that everything was fine, that my sinuses were clear, and it wasn't a sinus problem. That's not why I felt sick and why I was so exhausted. And so I asked if the physician could come in, and it was the guy that was on call, and he reassured me and seemed annoyed that he had to come in. And I didn't really get to look at my CT. I just trusted that they had looked at everything and everything was fine. So fast forward to last month, and I had been to this new dentist 6 months ago, and they did a CT scan, and they can do same-day crowns. That was actually why I ended up with them, and they're fantastic. And they saw like 3 different teeth that needed attention, and I had those crowns done, and nothing else was said, but I had a CT then. And so I went in about a month ago and had pain in the tooth, and I just wanted to get it checked out. And they looked at my CT again. They said, well, the tooth you came in for is fine, but you have an abscess above this tooth. And that's the first time anybody's ever said anything to me about that. So I looked back, I got the picture of my sinus CT from 2023, and this is what they could see. And this is my sinus cavity. It's like a cross-section cut through my face. And this is my nose and the normal bones and the openings, the big openings to my sinuses. But that right there is my tooth. And you can see that bone that's all messed up right there in that dark area. That's the tooth abscess that was there 2 years ago. And it's been there for a lot longer than 2 years. This is another image of the tooth when I went to see the endodontist. And I don't know if you can see this very well, but you can see that dark area above the tooth. That's all infection. So the endodontist said, well, we can go in there and fix it. And he said the reason this happened was because in 1999 or 2000, when they first did this, they didn't use a microscope when they do root canals. And so they missed a 4th canal in my tooth. So literally that tooth has been open to the inside of my mouth ever since I had that root canal done. And I've gotten recurrent infections. So I went and had the thing cleaned out last week. And when he went in to do that 4th canal, literally I had a big rush into my sinus and it got cold in there. And when I came home, a lot of the infection actually came out of my nose when I irrigated. And that's super gross. But just sharing because somebody else is dealing with the same thing and you need to know. So I felt exhausted for about 2 days, and the last 2 days are my 3rd and 4th day after the procedure, and I'm already feeling a lot more energetic. And I just want to say that if you are having unexplainable medical problems of any kind, don't stop seeking the answers, because there is somebody out there that can help you figure this out, and you need doctors that listen to you. And I always try to give that courtesy to my patients, and I take a little longer when I see people, and I'm not perfect, and I miss stuff sometimes too, probably, but I recognize that there are big weaknesses in this system, and this needs to be addressed. So please feel free to share. I hope this wasn't too long, and I appreciate you listening. Thank you.